Okay, so how do we treat these? By the way, I'm not talking about the causes of eating disorders, so make sure you go and review that in your textbook. Um, let's talk about how we treat them. Okay, the basic idea for the treatment of eating disorders is to change the pattern of eating that is causing the problem. In order to do that successfully, generally speaking, you need to get to the underlying thoughts and feelings that are inspiring the disordered eating behavior. So, looking just at anorexia for a minute, um, the immediate thing that you need to do when somebody is seeking treatment for anorexia is to get them closer to a healthy weight, right? So that's helping them regain the lost weight and deal with whatever malnourishment issues they've got in terms of low levels of minerals in their body and electrolyte imbalances, et cetera, et cetera. And then once the immediate crisis is past, teaching them to eat in normal patterns again. Um, in order to do these things, first you want to get people back to um, their wow, sorry, I got distracted there for a second. There was something off in the corner of the screen. What? Okay. You want to get them back to their normal eating, their normal weight, and so this may require IV, like actually putting an IV in and putting nutrients into their system. That way, if they're in an extreme situation where they either are refusing to eat or are unable to eat as much as they need to. Um, then, in order to help them move back closer to their weight and regain their normal eating methods, um, th- not only are you going to be feeding them high calorie foods in order to help them restore their weight, but you're going to be engaging in some nutritional counseling, teaching them how to balance the nutrients that they need, and engaging in some counseling and motivational interviewing to uh, motivate them to want to eat, to want to take care of themselves. Now, in order to, once you've got somebody back to a healthy weight or a safe weight, then in order, I mean, as soon as they're out of the inpatient care, they're likely to go back to the patterns that they're used to. So you're going to need to engage in some therapeutic talk in order to address the underlying thoughts and feelings that are causing the problem in the first place. So this is figuring out solving strategies. What are your triggers? What are the issues? What are you thinking? Which of those thoughts are ineffective or harmful, and how can we get you to think about them differently? Teaching somebody to monitor their own levels of hunger, that's something that tends to be, these folks tend to be really bad at. They've learned to ignore their own hunger, um, and to the point where they may not even feel it. And so teaching them to feel their hunger and monitor that, and monitor their food intake so that they know that they're getting a safe level of food. Um, and then at the deepest level, teaching them to change their own views on their weight and how their body looks, and help repair their body image. Um, this can be very, very successful, and frequently is, so long as you stick with it, right? The best outcomes tend to be those who continue in therapy for at least a year after they have recovered a healthy weight. And then that's long enough to help folks get to a level where they can then um, begin to monitor their own food levels, and begin to think in more healthy patterns. Now, a lot of this requires not just the action of the person themselves, but also changing their family dynamics that tend to reinforce the old anorexic behavior. Um, and teaching the person that they have needs and responsibilities to themselves separate from their responsibilities to their families. The classic anorexic is someone who feels a deep sense of responsibility and has to take on a lot for other people as well. And so teaching them that they can actually take care of themselves, that sometimes that comes before other people, is an important part of that. Now, getting somebody back to a healthy weight generally doesn't take too long. You can usually do that within a few weeks or a couple of months, even in severe cases. And the majority of clients seeking help for anorexia do improve. Um, you've got about a fourth of individuals who continue to experience some level of difficulty either with their eating or with other psychological problems. So it's not always a cure-all for everybody, but generally speaking, the success rates are very good with anorexia. Now, for bulimia, treating bulimia is less about, you usually have to worry less about an immediate crisis of health and getting somebody back up to a healthy weight, and more about changing their binge eating patterns and purging patterns. So, much like anorexia, you frequently there will be inpatient clinics where folks will go and stay for a while in order to have their eating and most of their interactions monitored, where they're spending a month or a few months just sort of focused on, I'm getting better right now. Uh, and a lot of this has to do with teaching them how their bodies work and how nutrition actually works, as much as changing their thoughts about their own weight and how their body looks. So CBT is a big one here, where we're focusing not just on the behaviors, but also on the cognitions. So on the behavioral side of it, you've got people keeping diaries, not just for their emotions, but then also food diaries, so that they're keeping really good track of what they're eating. And then exposure and response prevention. This is exposure to a stressful scenario that might lead to binge eating behavior under normal circumstances, but it's done in controlled conditions where you can help prepare the person, talk them through it, and prevent the binge eating response, so that the connection between that stressor and the binge eating response is weakened, so that they know there is another option in terms of how to respond to that scenario. And then teaching them to change how they think about things, changing how they feel about their relationship with food and eating, and the weight and shape of their own body. And teaching people to recognize their own negative and problematic thoughts, so that they can derail them before that then turns into a binge eating episode, is super effective. And you may pair that up with other kinds of therapy as well, psychotherapy or family therapy. Sometimes antidepressant medications are useful in terms of reducing the desire for binge eating under certain cases. One way or the other, it needs to be treated, because if left untreated, bulimia can last for years and even decades and end in a person's death, as I mentioned earlier. The success rates are a little lower here than they are for anorexia, but still significant, where you see improvement in 40% of cases and then a moderate response in another 40% of cases. 10 years after treatment, you've got 75% of people who are either fully recovered or partially recovered, where they have better management of their own eating, even if they may still suffer from some binge and purge episodes, right? And those, if you do get somebody who relapses, those tend to be triggered by high levels of stress. Okay, now binge eating disorder we didn't really talk about much. That's essentially the binge eating without the purging, but the treatments tend to be very similar to those for bulimia. You just don't, I mean, folks who suffer from binge eating disorder tend to be pretty heavily overweight because they're eating a ton of food and not getting rid of it. And so that tends to be paired rather than with some of these cognitive behavioral methods that are intended to derail the binging and then purging cycle. You're trying to derail the binging and then pairing that with an exercise program to get people back to a healthy weight from a high weight. This tends to be less effective long term than treatment for bulimia. We have high risks of relapse, not least because we live in a society that has a pretty unhealthy relationship with food, generally speaking, and a lot of our food options that are easily available and cheap are really, really bad for you. This is one that we're still trying to figure out the most effective ways to deal with. Okay, that's it for this chapter. Best of luck on the midterm. Please do email me if you've got questions or concerns. Thanks, everybody. Talk to you soon.